There are a variety of clinical skills that nurses perform as part of their duties. In this video, we'll offer some best practice advice and guidance based on the Royal Master Manual for administration of intramuscular or subcutaneous injections. Speak aloud throughout to explain your actions even when not addressing the patient. Pay close attention to the scenario that you have been given. It may be taking place in a non-hospital-based setting. Check for scene safety, bearing in mind that you might be in the patient's home and might need to consider, for example, whether they have any pets or young children. Introduce yourself, explain what you are going to do, and ask the patient to confirm their full name, date of birth, and address.
Hello, good afternoon.
Hi.
I'm Jamie. I'll be the nurse looking after you today. What I've come here to do is give you an injection. So can you tell me your name, please?
It's Anne Smith.
All right. What can I call you?
You can call me Annie.
All right, Annie. So, Annie, can you tell me your date of birth?
Yeah, it's the 30th of the 12th, 1963.
Yeah, it's 30th of the 12th, 1963. And can you tell me your address?
Yeah, it's One the Way, Any Town, A1 1AA.
Check for allergies. Remember, in a community setting, the patient will not have a wristband. It's important to establish previous injection sites to ensure you do not administer into the same site each time. This avoids unnecessary tissue damage.
Annie, can you tell me, have you been receiving any injections before?
I do, yeah, it's my vitamin 1, I have it every month.
Right, so I've come here to give you the next dose of that hydroxycobalamin injection. So can you tell me when was the last time you received that?
About 4 weeks ago.
Right, so can you tell me where was the site that you received the injection?
Yeah, in the top of my right arm.
Right, so you've got it on the top of your right arm. So would you mind if I give it on your thigh this time? This is to just alternate between the sides. Is that all right?
Yeah, that's absolutely fine.
Tell the patient where you will administer the injection and check that area.
Okay, so am I all right checking your thigh for the injection?
Yeah, no problem.
All right, so I ensure that all the doors and windows are closed and adequate privacy is given to the patient. All right, Annie, so I'm just exposing that little bit of your thigh to just have a look at the injection site. Is that all right?
Yeah, that's fine.
Okay. So I checked the site for any redness or any inflammation and no signs of any allergy or any inflammation. So I ensure that I'm convinced that I can give it on that site. Right. Okay, Annie, so I'll be going back and gathering all the equipments needed for your injection. Is that all right?
Yeah, that's fine.
Before preparing the equipment, clean your hands.
All right, so I'll be gathering all the equipments needed for the injection. So I'll do the hand rub first since I've touched the patient.
Check the prescription details against the medication. Remember to check the 5 R's. Record the batch number on the prescription chart.
After doing the hand rub, I'll do a full prescription check of all the details of the prescription. So it is Anne Smith and the address and date of birth is checked. The drug name is hydroxycobalamin. 1 mg per ml is to be given, and it is to be given by the intramuscular route. The prescriber's signature and date and time is written. So I will go ahead and check the drug with the prescription. So it is injection hydroxycobalamin, 1 milligram per ml injection to be given by intramuscular route. Its expiry is on 8th of 2018 and the batch number is 12345. So I need to write down the batch number and it is 12345.
Check the ampule is intact with no leaks.
I'll check whether the ampule is intact and it's not leaking or anything.
Check the packaging and expiry date on each of the loading needle, administration needle, and syringe.
So I've done the full prescription check and now I'll be gathering all the equipments that's needed. So I take the loading needle and I check the expiry. Its expiry is valid and its packaging is intact.
Similarly, take 2 alcohol swabs and check the packaging and expiry date.
So I take the alcohol swabs, 2 of them, and check its expiry and packaging is valid.
Put on gloves and carefully clean the ampule with one of the swabs.
I'll be cleaning the hub of the ampule for 30 seconds and allow it to dry for another 30 seconds.
Fix the loading needle into the syringe and place in the clean tray.
Now I'll be loading the injection. So I'll take the syringe, I'll take the loading needle.
Open the ampule, load the medication and expel any air bubbles. Verbalize the amount of medication required.
Now I'll be loading the medication, and it is 1 ml that is to be administered, and I ensure that no air bubbles are there inside the syringe.
Change the needle using either the scoop or direct removal technique, and again check the dosage in the syringe is correct. Dispose of all sharps safely in a designated sharp container.
And now I put in the next needle by ensuring that I do not touch any parts. So this is the administration needle, and I again ensure that the correct amount of dose is inside the syringe.
Show the assessor that the dosage is correct and there are no air bubbles.
So I finished loading the medication, and I need to show it to the examiner. It's 1 ml and no air bubbles.
Yeah, that's correct. Continue.
All right. So I'll be putting it into my clean tray.
Place the syringe, gauze and alcohol wipes in the clean tray and take to the patient. Returning to the patient, ask if they are happy for you to expose the area of injection. If in a community setting, request permission to use their sink to wash your hands.
Hello, Anne.
Hi.
Am I all right exposing your thigh to give the injection?
Yeah, that'll be fine.
All right. So I'll make sure that the patient is exposed to the minimum.
After washing your hands and putting on the apron, reconfirm the patient and prescription details and explain what you will be doing.
Anne, can you tell me your full name, please?
Yeah, it's Anne Smith.
Right. Your address?
It's 1 The Way, Any Town, A1 1AA.
Yeah, that's right. It's 1 The Way, Any Town, A1 1AA. Can you tell me your date of birth?
Yeah, it's the 30th of the 12th, 1963.
Right, 30th of the 12th, 1963. So I'm going to give you the hydroxycobalamin injection, which is 1 ml. All right?
Yeah, that'll be fine.
So Anne, I'll be giving you the injection now. I'll be asking you to take deep breaths before giving the injection, and I'll be cleaning your area of injection with the alcohol swab. Is that all right?
Yeah, that's fine.
Clean the injection area for 30 seconds and allow to dry.
So I take the alcohol swab and I clean the injection site for 30 seconds and allow it to dry for another 30 seconds.
Check the patient is ready and talk through the injection process.
So I'll be stretching the skin with my non-dominant hand, and I'll be holding the syringe like a dart, and I'll be going in at 90 degrees. All right, Anne, can you please take deep breaths?
Yeah, will do.
And I'll make sure that I'll leave a centimeter of the needle out, and I'll aspirate to check if there's any blood. I see that there's no blood. I'll be injecting at the rate of 1 ml per 10 seconds. So it's 1, 2, 3.
Allow the needle to remain for another 10 seconds before withdrawing swiftly. Place the gauze over the injection area and dispose of the needle.
So after ensuring that I've put the needle for another 10 seconds, I'll be removing the needle swiftly, and I'll keep the gauze, the injection site, and I'll make sure that I do not rub the injection site.
Always ensure sharp disposal safety, including the use of appropriate sharp disposal bins.
And I'll be discarding the needle in the sharps bin after ensuring that the sharps bin is not full.
Check the site for bleeding and recover the patient.
So I just assess the site, and the site is not oozing or bleeding, so I do not apply any plaster. Okay, Annie, we're done with the injection, and I'm just covering your back.
Tell the patient you will be there for another 30 minutes.
All right, Annie, so I'll be around for another 30 minutes. If you need anything, you can just let me know. By the time I'll just finish my documentation. Is that all right?
Yeah, that's fine.
You might also want to give advice on where to go for follow-up help, such as a local walk-in center. Complete the documentation including your signature, date, time, batch number and expiry date, site of injection, and any additional nursing notes such as signs of reaction in line with NMC guidelines.
So I go back and do the documentation of the details of the injection given and the site given, and I sign and date the time.
Some of the key points to remember when demonstrating these skills in practice are: Take into account any risk posed to yourself or the patient by the environment and manage appropriately. Check for allergies. Remember, in a community setting, the patient will not have a wristband. Ensure you develop a rapport with the patient appropriate to the hospital or community setting. Ensure you have patient consent before delivering the injection. Observe sharp safety at all times and address any concern. For example, if the sharps bin is full.
Best practice is to state that any documentation will be completed and specify that you used ANTT.
This concludes our overview of the administration of intramuscular or subcutaneous injections.